This video is about treatment of dementia. Now let's talk about the treatment. This is my third video about dementia. First one was different types of dementia and the clinical features, and second one was about prevention. This is about treatment. So again, I want to be very clear. For most dementia, treatment has several layers. First of all, as a doctor, we want to treat the reversible contributors. And then you try to treat the specific dementia when possible. And then you got to support functionality of that person and safety and reduce complications, and you got to support caregivers. To treat reversible contributor first. That includes correcting B12 deficiency, managing thyroid problem, treating depression, improving sleep, treating hearing problem, treating sleep apnea, treating vision problems, and going over polypharmacy and getting rid of the medication which are not essential. And then, of course, physical and mental activities, and also controlling an infection and metabolic issues. Sometimes cognition improves meaningfully when these issues are addressed. For Alzheimer's disease, sometimes sometimes other dementia, commonly used medication is donepezil, rivastigmine, galantamine, and memantine. They do not cure dementia, but they help some patient with symptoms and function and rate of decline for a period of time. Rivastigmine is also often used in Lewy body dementia or Parkinson's related dementia for cognitive symptoms in appropriate patient. Although the treatment should be individualized, usually these patients end up seeing a neurologist and a regular follow-up. Then the disease modifying therapy for early Alzheimer's disease. These are one of the biggest recent changes in this field. FDA has approved anti-amyloid therapy. Like the famous one is called Leqembi, 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 and then the other one is called Kisunla, Kisunla. For early Alzheimer's disease, meaning patients with a mild cognitive impairment, mild dementia stage with confirmed amyloid pathology, these drugs are not for every patient, require careful selection, counseling, monitoring, and discussion of risk. And because some of the medication can cause brain swelling and bleeding as well, so it has to be very careful with this treatment. It's not a simple memory shot. It has to be prescribed by neurologists and followed through. It's a specialized decision that usually involves neurology, imaging, biomarker confirmation, and structured follow-up. Treat vascular risk aggressively. So in vascular dementia or mixed dementia, controlling blood pressure, diabetes, kidney function, cholesterol, smoking, stroke risk, atrial fibrillation, and exercise habits and other relevant factors is a key part of the treatment. This may not reverse established damage, but can help reduce further injury. Non-drug treatment is essential, and this is often underestimated. I have a video about this non-drug treatment on dementia, so you can check it out. Non-pharmacological care includes routine and structure, exercise, sleep support, caregiver education, fall prevention, hearing aids if needed, occupational therapy, speech therapy in selected cases, memory aids, simplified instruction, environmental safety, behavioral strategies. These measures often make a big difference in quality of life. And then there's behavioral and psychological symptoms. Patients usually develop agitation, anxiety, depression, paranoia, hallucinations, sleep problem, wandering. The first step in those cases is just to make sure there is no bladder infection or constipation or side effect of medication or lack of sleep or environmental overload, fear or confusion. Behavior is often communication. Medication can sometimes be necessary, but caution is very important, especially in Lewy body dementia, where certain antipsychotics can be poorly tolerated. Issues family should not ignore. If dementia is suspected, family should think early about driving safety, medication management, fall risk, stove and kitchen safety, financial vulnerability and scams, wandering risk, firearms if present, and future planning. This is not about taking away dignity, this is about protecting independence safely for as long as possible. When should someone seek medical evaluation? Please seek medical evaluation if you notice repeated memory lapses which are worsening, getting lost in familiar places, major personality or behavioral changes, trouble handling money or medicines, visual hallucination, frequent confusion, language decline, falls with cognitive change. Early evaluation treatment is important because it can reveal treatable, reversible condition and mild cognitive impairment, dementia subtypes, and safety risk. And sometimes also eligibility for newer therapies in right patient. Bottom line is dementia is not one disease. Major types include Alzheimer's, vascular, dementia with Lewy bodies, frontotemporal dementia, mixed dementia, and some less common causes. Prevention is not perfect, but risk may be lowered by protecting vascular health and staying active, sleeping well, avoiding smoking, treating hearing loss, cutting alcohol, staying socially and mentally engaged. And workup includes careful history, cognitive testing, functional assessment, medication review, lab test, brain imaging, sometimes biomarker testing. And treatment is already focused on reversible causes, symptomatic medication, lifestyle and safety planning, caregiver support, and in some cases, disease modifying therapy. So please remember, not every memory problem is Alzheimer's, not every dementia looks same. And earlier the evaluation, better the chance to plan well and treat wisely. I'm Dr. PK. Take care of your brain because brain health is life's health. And this is my third video and last video about dementia today. Thank you for watching.